Welcome back to TV5 News at 9. Today we are talking about minimally invasive surgery with Jaganathan Neurosurgery. Joining us this morning is board-certified neurosurgeon Dr. Adam Kramer. Thank you so much, Dr. Kramer, for joining us.
You're very welcome. Good morning.
Good morning. Okay, so first tell us, what is minimally invasive spine surgery?
So, to the patient, it means a smaller incision and a faster recovery. But from my perspective, it's just a much more accurate way of addressing the root cause of the problem. So instead of having to remove a bunch of bony anatomy and move muscles to get to the pinched nerve, I'm able to use a tube and the microscope and to much more precisely attack the problem.
And Dr. Kramer, so what are the benefits of this type of surgery?
Well, it's much safer, faster, and ultimately better. The patients are able to mobilize much more quickly after surgery, and they don't need to have a prolonged stay in the hospital or, rehab facility. They're able to resume activity much more quickly. And obviously that has a bunch of benefits, especially when you're dealing with the spine.
Yeah, that sounds like a win-win for everyone. Also joining us this morning is patient Walt Simon. Thank you so much for being here and joining us today, Walt.
Thank you.
That's great. We're so glad to have you. Okay, so you actually had the surgery. Tell us about your experience, Walt.
Well, my experience was fantastic with the doctor. I have never had a doctor call me on a Saturday or a Sunday, ask me how I am.
Oh, wow.
And before I had the surgery, he called me every day. And he explained everything to me, what was going to happen, showed me on a screen, and that was exactly the way it happened. I'm just glad that we ended up at Bay Medical. Fine place.
Oh, that's terrific. So you had a great experience with Dr. Kramer. Tell me about this. What was your experience and how's your recovery going, Walt?
Oh, my recovery is going great. I'm walking without anything now, and I don't have any problems at all. I don't have never taken any pain medicine. Just Tylenol and ibuprofen. And I've had good care at home too, because my wife is pretty strict with me.
I love to hear that. She loves you and she wants to make sure you're okay. So that's terrific. Well, we're so glad to hear that you're doing well and that you're recovering. Thank you for joining us, Walt. We appreciate it.
Yeah.
Now, Dr. Kramer, tell me what other conditions that you treat as well.
So all the common conditions, one is called spinal stenosis, where the body generates a lot of bone spurs that ultimately build up and start to squeeze the nerves and suffocate the nerves. It makes patients have difficulty walking. Their legs get weak, numb, and tired, and they have to flex forward. That's called spinal stenosis. And then the other main condition would be pinched nerves, like disc rupture, where the nerve gets pinched and a patient experiences severe back and leg pain. It's also super helpful for there.
That's great. Well, Dr. Kramer, I think that's the first time I've ever heard that a doctor called a patient on a weekend, so we know that you're doing an awesome job. Thank you so much for joining us today, Dr. Kramer. We appreciate it.
Very welcome.
And if you'd like any more information about this topic, just head on over to the hot link section of WNEM.com.